Since the coronavirus disease was declared a pandemic in 2020, many things have happened, among which are the painful loss of lives even in countries with developed health institutions, disruption of the socio-economic state of the world, and the enshronement of a new normal with the safety protocols of social distancing, hand washing, and wearing of face masks. In fact, COVID-19 caught the world napping and wreaked unimaginable havoc on the global health system.
It caught the world napping, but I know that Nigeria started preemptive action because this pandemic was all over the world already, particularly in well-known places like China, Italy, the UK, before we got the first index case in Nigeria. So a committee was set up by the federal government to look at our response. So it really didn't catch us napping the way it caught the world napping.
Because of our huge size and inadequate healthcare facilities, Nigeria was considered vulnerable, and the worst was predicted to happen in a country already categorized by the World Health Organization as among the 13 high-risk African nations. Contrary to expectations, however, the federal government rose to the occasion and proved the naysayers wrong by providing a formidable response to the pandemic.
God has been gracious to Nigeria or to Africa, but to Nigeria in the sense that we have one of the lowest death rate ratio in the world.
The casualty in Nigeria is almost like a sprinkle if we compare it with the projections that have been given. Because if we look at our inadequacies in terms of health facilities, you wouldn't think that Nigeria would not have been overrun.
No doubt, the federal government has done a good job in managing the pandemic through its relevant agencies and the presidential task force headed by the Secretary to the Government of the Federation.
The president set up the presidential task force, which has transformed into a presidential steering committee now, headed by Boss Mustafa, the Secretary to the Government of the Federation. And we saw all that they did because they kept addressing the nation through press conferences. At times they could do it. At times, there was a time it was daily. And later it became thrice a week. In fact, in the first 1-2 months of the pandemic, the president himself made about 4 broadcasts. So we saw that the country tackled the issue head on. And God's grace and the work that has been done has led to where we are.
Successful and commendable as the COVID-19 response may have been, one wonders how much could have been achieved without the role played by the National Agency for Food and Drug Administration and Control, Nafdac.
The role of Nafdac, when we talk of the success story of the effective management, containment of the COVID pandemic in Nigeria, Nafdac has a complete chapter in that story. And you cannot take it. But we were quite at the background, working on song. Nobody talks about Nafdac. But if you remove Nafdac, the whole effort of federal government control will just collapse. Because at that moment, 24 hours, we are on the front line. Even though people are not seeing, you are seeing the medical doctors out there saving lives, but at the background of those equipment, those things they're using in saving lives, somebody was regulating, somebody was ensuring it went on very fine.
When Professor Mojisola Christiana Adeyeye was appointed in 2017 to head Nafdac by President Muhammadu Buhari, many people held the appointment as appropriate and deserving. For here was the founding chair of the Biopharmaceutical Sciences and seasoned professor of pharmaceutics, manufacturing, science, and drug product evaluation from the College of Pharmacy, Roosevelt University, Illinois, in the United States of America. Under the leadership of this eminent scientist and the innovations she brought to bear in the management of Nafdac, the agency was proactive and diligent in dealing with the pandemic.
We were prepared for the pandemic. During the 5 months lockdown, we were working because we have to approve sanitizers, testing kits, PPEs, masks, face masks, things that we weren't routinely approving. Despite the lockdown, we were able to. We had 26 sanitizers in our database. It became 255 or something companies. Testing kits, the same. Our labs were working around the clock. Port inspection was working around the clock. Registration, yes. So the COVID pandemic also taught us a lesson that you have to be ready for a pandemic. So our business continuity approach changed. We have to learn that quickly.
On arrival in 2017, Professor Adeyeye decided to reset the tone of Nafdac with a new maxim that reflects the nature of its activities and the supervisory function it performs. Nafdac became customer-focused, agency-minded.
We became customer-focused, agency-minded. If you are customer-focused, agency-minded, it means you love your country. If you are not customer-focused, you are not agency-minded, you don't love Nigeria. That set us on a journey. And that journey took us through quality management system training for 1.5 years. And we've got our ISO 9001 in 2015 June, after we cascaded the training from Abuja, Lagos to zones to states. How do you think of customer? How do you put the customer first? That transformed us. Are we there yet? No. It is a journey, but it is night and day compared to where we were.
But she believes that based on the nature of the job we are doing and also the paradigm shift in the focus, in the emphasis of our regulatory activities, there is need for us at Nafdac to make our regulatory activities to be customer-centric, that is customer-focused. In other words, the customer become the pivot on which all the regulatory activities revolves around. So that is just in a nutshell the meaning of that.
Determined and focused on realizing the objective of the outfit, Professor Adeyeye embarked on the arduous task of turning Nafdac around. 4 years down the line, things are beginning to look up for the agency, thanks to the customer-centric mindset of the DG and her staff.
We are now SOP-driven, standard operating procedure-driven agency, meaning we have to follow step by step in our processing. And that aligned well with the PEBEC objectives and MSMEs. Companies will send vehicles for inspectors that were coming to inspect their companies. And you know what the bottom line is. You have to do a favor in order to, inspect that place successfully or whatever from the company's perspective. You don't get favors from the regulated. And if you don't have money, you will not be able to buy vehicles. We didn't have vehicles.
A graduate of pharmaceutics from the University of Nigeria in Nsukka and the University of Georgia, United States of America, where she earned her doctorate, Mojisola Adeyeye came to Nafdac with a clear vision of what she wanted to accomplish and could not be deterred by the challenges she met on arrival.
Our staff face dangers every day. Our staff face dangers every day. And I wish the president could hear what I'm saying. One of our staff in Kano, the daughter was kidnapped because he was doing his work. A driver in Akwa Ibom got death threat because he was driving people, inspectors, to where they are going to seize falsified medicines or unwholesome foods. It is all over the country. One of our staff was beaten almost to death at the ports. They locked him up in the container that he was inspecting, and he was in the hospital for about 2 weeks. A lot of our staff get death threats. And it's not once in 3 years. It's maybe once every quarter, once, or every other month, death threat. So Nafdac is not a typical civil service organization. We face dangers. When I came, I never knew that Nigeria was swimming in the pool of tramadol. And from very high up, I got a tip that there are 31 containers of tramadol that are coming our way. Out of 31 containers, only one had what was on the label. Building materials, computer, or whatever. Only one. Our staff were keeping vigil. I'm talking of sleepless nights at the ports. We were able to intercept 26 containers of tramadol. One of them was diverted because they now knew that the port was hot. Meanwhile, Nafdac was never at the port for 7 years. It was May 16, it was Buhari government that sent Nafdac back to the ports. That was why we could do what we were supposed to do.
Mrs. Adeyeye is driven by the force of her convictions and is undaunted by challenges. On assumption of duties as the head of Nafdac, with its onerous responsibilities of regulation and control, she approached her assignments with a determination to realize the core mandates of the agency.
The core mandate of Nafdac is to control and regulate the importation, exportation, manufacturing, advertisement, sale, use of our 7 regulated products.
If you remove the oil sector away, Nafdac will pretend over the non-oil sector of the economy, which is very, very ramifying and very big. You talk of the pharmaceutical company. As I speak with you, we have over 165 pharmaceutical manufacturing outfits in Nigeria. Then you talk of the retail aspect of them, over 1 million patent medicine stores all over the country. Then you talk of the packaged water industry. The packaged water industry alone in a day, by the time you wake up early in the morning before the close of the day, over 10,000 billion, over 10 billion naira worth of packaged water would have been consumed. I'm not talking about when we have Owambe parties at the weekends and all those stuff. So then you talk of the chemical industry, down to the petrochemical industry. Nafdac is regulating it, supervising, inspecting, also checking the imports, down to the petrochemical industry and all the factories that use chemical. Then you now talk of medical devices, then the detergents, then the food itself alone. Food.
A senior Fulbright scholar and founder of the Elim Pediatric Pharmaceuticals, based in Rolling Meadows, Illinois, Mrs. Adeyeye came to Nafdac with a positive mindset.
My dream for Nafdac, first of all, to get to maturity level 3 so Nigeria can manufacture our own vaccines, and then maturity level 4. Once we get to maturity level 4, Nigeria can trade its food and pharmaceutical products anywhere in the world. You can imagine what it will do to our economy.